disorder services in Oxfordshire Foundation Trust cover 3 geographical areas: Oxfordshire, Buckinghamshire and Wiltshire. In Oxfordshire and Wiltshire we have inpatient, daypatient and outpatient services, whilst in Buckinghamshire we have outpatient services. The 3 teams consist of multidisciplinary staff, and we work very closely together to ensure patients have the best outcomes that they can have by using multidisciplinary and evidence-based treatment.
The teams have nursing staff, psychiatric staff, psychology and therapeutic personnel, dietetic and admin personnel. Both teams offer the nice concordant treatments for eating disorders, including mantra and CBT.
We have a strong culture for improving patient outcomes and patient care, and have been working closely with patients and carers to improve the service, and this is an ongoing process which we highly value.
Eating disorders are associated with a high rate of medical and psychiatric comorbidities. 2/3 of patients affected by anorexia nervosa develop physical complications whose severity may vary according to different factors. Such complications can involve all the body organs and systems. Sadly, the SMR, the standardized mortality ratio for anorexia nervosa, is between 5.9 and 6.2, while for bulimia nervosa is 1.9. This means that people affected by anorexia nervosa present a risk of dying that is up to 6 times compared to the general population, while people affected by bulimia present a risk that is double. Therefore, it is very important to implement a thorough medical monitoring in order to avoid incidents that might be fatal for our patients. It is crucial to emphasize these aspects and work collaboratively and jointly with the other primary and secondary care services in order to guarantee our patient safety and quality of life.
Apart from the physical risks, eating disorders have a serious impact on the psychological functioning of patients. Some patients can feel isolated, anxious or depressed, or even develop a risk of suicide and self-harm. So we want to work very closely with carers and family members, and also the local crisis and adult mental health teams and the general and psychiatric hospitals. In terms of psychological treatment, we offer a range of talking therapies, including guided self-help, the Oxford model of cognitive behavioral therapy for eating disorders, and family therapy.
We have a strong commitment to include patients and carers in improving services, and provide regular carer support groups during the weekend to help families help their loved ones to improve their outcomes.
Using cognitive behavioral therapy, we know that certain factors can contribute to and maintain the eating disorder. Many of our patients struggle with issues of body image, the need to be in control, dietary rules, perfectionism, low self-esteem and interpersonal difficulties. But these factors exist in a unique combination for every patient, and rather than treating every patient with anorexia nervosa in the same way, we want to understand and develop a diagram of the unique maintaining factors for every patient.
Cotswold House is a 14-bedded unit with 6 day patients that come in every day except Wednesday, Saturday and Sunday. They attend from 8 o'clock in the morning until 4 p.m. Our service uses the Oxford model of cognitive behavioral therapy for eating disorders. Our team comprises of doctors, nurses, physiotherapists, occupational therapists, admin officers, housekeepers, psychologists and dietitians. There are patients who want to recover and those patients who are there for crisis management. We offer a stepped care model that takes care of the needs of individual patients.
Inpatient treatment is often criticized for only focusing on weight restoration, but the formulation helps us to place an equal emphasis on psychological and physical recovery, which means that we can treat the whole person in a holistic and integrated way. Patients don't want to tell their stories again and again, and with their consent we want the formulation to follow them across the outpatient, daypatient and inpatient treatment, and for their formulation to inform their treatment goals and also the interventions that will be delivered by the whole multidisciplinary team.
We are part of a network of service providers called HOPSPA. The aim of the network is to effectively manage eating disorder beds.
We have just been accredited by the Royal College of Psychiatrists Quality Network for Eating Disorders, which is a national benchmark for excellent clinical services, and we are very proud of that achievement. We are actively engaged in research and quality improvement and have been presenting our work at national conferences.
If you're living with an eating disorder, we'd like to help you. We'd like to help you understand the relationship that you have with food and the choices that you're making about your eating. When you're referred to us, we'll arrange an assessment with you and we'll spend some time with you thinking about the issues that you're having with your eating. If you'd like to know more information about our service, please see the link below.